We are also working within EORTC on a new trial, which is the EORTC 2129 treat ctDNA Elacestrant, which is a new trial where we will investigate whether patients with early breast cancer who have ctDNA relapse during follow-up can be treated with Elacestrant in order to improve their outcomes. That's a short summary of the trial. So we know from the recently published Emerald trial, phase 3 in advanced breast cancer, that Elacestrant is a very active compound in breast cancer patients, is in fact superior in second-line advanced endocrine receptor positive breast cancer in comparison to alternative endocrine treatment. And we also know from both breast cancer and other cancer types that patients who are ctDNA positive after radical treatment of their disease have a very high chance of recurrence. In fact, we know from many breast cancer trials that the lead time from ctDNA positivity to clinical relapse is actually only about 11 months. So that most of these patients relapse within the year after becoming ctDNA positive. They develop clinical relapse. So the question or the hypothesis is that whether treating these patients at the time of their ctDNA relapse, when the disease is still more limited, might not actually be able to improve their prognosis and even to increase the cure rates in comparison to waiting for the time when the disease is overtly relapsed, either clinically or on imaging. So what we will do in our trial is we will monitor patients every 6 months with a ctDNA blood draw, patients who are ER positive also and are under endocrine therapy after completing their surgery, after completing all their other adjuvant treatments. And at the moment when these patients become ctDNA positive, we would randomize these patients to continue either continue their endocrine treatment that they were receiving before. So in fact, not really act on a ctDNA result, or randomize them to an active treatment arm with Elacestrant to see whether this might not be more effective in delaying recurrence.